been talking a lot about women's health this week, and it is no wonder that many people feel they just don't have a lot of control when it comes to their health care. Sorting through and selecting doctors, urgent care facilities, hospitals, it is a huge job, and once you make a selection, it can be confusing and even frightening. Now, the Centers for Disease Control says nearly 700,000 patients develop secondary health problems after staying in hospitals. Almost 75,000 die. Many hospitals are tightening up on safety guidelines, though, and are very safe environments. Still, experts say it's up to us to do our part to keep ourselves healthy and safe. So I am here with Dr. Joyce Gottesfeld, OBGYN at Kaiser Permanente, with some really great advice on how we can take control of our health care and keep our families safe. And, I guess it used to be that you felt like, well, the doctors, everyone, they know so much more than we do. We can just sit back and enjoy the ride, so to speak.
Well, I think now it's definitely more interactive. So when you go in to see your doctor, write a list so you don't forget anything. Tell the doctor what hurts. Tell the doctor what you're nervous about, and tell the doctor how this is affecting your life so they can help you.
Yeah, and people are concerned when they hear these reports about safety when they go to a place to get better. Some come out not doing so well. But what kind of safety guidelines are in place?
Well, there's a lot of checks and balances, particularly in the hospital where there's multiple team members, nurses, doctors, checking, double checking, electronic medical record, but pay attention. Have you as the patient, your family members pay attention. What medications are you getting? Stay involved.
Okay, well, and actually, let's put up a few of the tips that we have, because you shouldn't be afraid to ask questions, is what I've heard you tell me, is just, ask questions, speak up, ask a doctor about the safety precautions that are in place. Ask surgeons to use electric razors instead of hard edge razors. Practice hand washing. Those are some really basic things that you can do to feel better about the treatment you're getting.
Absolutely. And again, just pay attention. I like to show my patient I'm using my hand sanitizer when I walk in the room. Ask the nurse, what medication are you giving me? You can be part of that double check process as well.
Right. And also, you don't always have to run to the hospital for every little thing. And thank you so much, doctor, for joining us. And we'll continue to talk about that as we cover health issues here. But, Kaiser's got a really great nurse line you can call and decide before you go running to the ER. You may not even need to be in a hospital. So that is some great advice for you. Well, let's go to